Community Health Center. Good, how are you? Not good?
In 1971, the clinic, as it was then known, was situated across the street in one room, and it was so successful that it just took off.
And then the fourth is with Jesse. So the one with Dr. Campbell was canceled.
I think the community really welcomed it, and it was, you know, and that's why it grew so quickly, is because people lapped it up. I mean, in the beginning they didn't have anything in their own community. They would have liked to, but there were no doctor's offices, or very few of them. So the community was entirely supportive of
it. The origins lie with the community. The health center wasn't started by healthcare workers. It was started by the community. And because of that, we're always very conscious of responding to the community needs.
We have not a very traditional medical team.
Hi, Leanne. Hi. I have an appointment this afternoon.
Yes, I do.
We have a whole team of providers that include social workers, nutritionists, nurse practitioners, physicians, nurses.
They're concerned about.
So we work very collaboratively as a team to meet the needs of our clients here.
My name is Paul O'Hara. I've been a social worker here at the health center for 29 years now. I started in 1981. We certainly are unique, and we do have autonomy from the general delivery of healthcare through the province. So we can challenge the system in a way that people inside the civil service are much more challenged to do.
Hi, I'm Rose Fraser. I've been a community health nurse, staff nurse here at the North End Community Health Center for 20 years.
I'm comfortable today.
A lot of our clients that come to us are people who have not felt very trusting of the healthcare system because they've had concerns and issues in the past.
So what kind of night did you have last night?
It often is a challenge to break down or to get past those barriers. I think the way that we approach that most commonly is through that basic concept of respect, right? If you respect not only the individual but where they are. And if they are in a space where they're just not ready to deal with the issues that they might need to deal with, then you respect that.
My name is Patty Melanson, and I run the Mobile Outreach Street Health Program, MOSH for short. We get to work with people who have who are homeless, you know, who are living in shelters. You should go to bed. We see people whose lives are, you know, kind of challenged because of addiction and because of mental health, and sometimes a combination of the both. Here, for later, okay? You want me to put it in here? You're gonna put it there? Okay. Do you, I've got an extra sleeping bag in the van, and, you know, their stories and their lives are full of sometimes great tragedy and sometimes joy. And just bring good things to the world, and good things will come back, right?
That's the idea.
Yeah.
That's what I'm trying to do too.
I'm Jessa Jollymore, and I'm a dietitian at the North End Community Health Center.
Just pick the big one.
I'm also leading the North End Community Garden.
Just pick the, you know.
The community garden is something that grew out of a need to connect more in the community.
We have tomatoes on the side of the wall. Beans almost 12 inches long. Girls, come pick some beans. Yes.
Mr. Lopi
that's it. Just pick them.
was involved from day one.
So cucumbers.
Every single day. He gets people excited about what's going on at the garden.
This is some of the dill.
Oh, Mr. Lopi's great. He's, I mean, he's a long-standing member of the community. He's watched generations grow up. He's always there to help.
We have some cabbage in here.
He is such an ambassador, not only for the garden, but for the whole community.
Yummy basil!
So this is the building that we've occupied for a long time now, and we're busting at the seams and we need more space.
We need more space because the number of clients that we see is growing. You know, we had over 400 new patients last year, and so far this year alone we've had over 200 new patients. So this is a new space. We're renting both sides of it, and the really fantastic thing is that this side used to be a restaurant, and so now our dietitian can run all of the fabulous nutrition programs that she runs in a really big space that was designed for cooking food.
Looking ahead, well, it's very exciting times for us. We have a new facility that we'll be moving into so that we can actually start realizing some of the programs that we would like to do in Havant.
You can't manage people or direct them. It's about authentic engagement with people.
I feel honored every day to work with the people I work with. They inspire me every single day. I feel like I'm the lucky one.
I had a rooster from 1-year-old to 12-year-old, a Rhode Island red rooster.
How do you measure our effectiveness compared to something else? I don't know. Certainly we wouldn't be doing what we are doing if we didn't believe that it was the right way.
It's a journey that everybody has been on. We hope it's a journey towards better health for the community.
So it's a healthy diet overall.
I think it's also a journey in terms of making this model better known in the country.
It's a grain that you can get it from.
That may sound over-optimistic, but actually I don't think so. Just looking back at what's happened. Who would have predicted this 40 years ago?
There you go, beast.